Hello dear friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to discuss about chapter number 10, and chapter number 10 is all about the infant death. So we have to know first what is infant. So child age less than 1 year, or you can say up to 1 year, we call that child as infant, my dear friends. Neonate 0 to 28 days child is called as neonate. Now, yes, 0 to 28 days old child is called as what's a neonate. So, infant is less than 1 years of child, neonate is 0 to 28 days old child is there. Now, there are the three important terms you need to understand right here, sir. First is neonatocide, killing of a neonate. That means now the age of a child is between 0 to 28 days. 0 day is equal to the day child born, the day child born. Guys, neonate, killing of neonate between 0 to 28 days. Filicide, killing of fetus by the parents. If parents are killing their child, this is called as filicide. Filicide, a very important definitions are going on. Filicide, killing of fetus by the parents is called as filicide. Parents kill their fetus. Most common cause is gender discrimination. Most common cause is gender discrimination. Gender discrimination, mostly they prefer their child should be male. Who are the victims? So victims are the girls. Girl child. Girl child is a victim. Viability. Sir, age of fetus to survive outside the uterus is called as age of viability. Means the baby, the fetus, when it is coming outside and he or she is able to survive. For example, in India, age of viability is 28 weeks. It depends on the healthcare system. Depends on healthcare system of country. Healthcare system of the country. How efficient the healthcare system is. If the baby is born at 28 week or 28 week onwards, will that healthcare system be able to save that baby or not? If that healthcare system is able to save that baby, we consider that child as viable child. But in the other countries like UK, USA, other country, UK, USA, the age of viability is, my dear friends, 24 weeks. That means their healthcare system is very much sufficient to get that baby into normal life after 24 weeks of birth also, my dear friends. But in India, it is 28 weeks. 28 weeks. Done? Now, sign of viability. How will come to know the baby is viable or not? So there will be a crown to heel length. Crown heel length should be at least 35 centimeter. Now I'll ask you, what is a normal? What is a normal baby? Normal height of a baby at the time of birth, that is 50 centimeters. So how we were calculating the intrauterine heights? So there were two rules we followed yesterday only. We talked about, sir, at 1 month, 2 month, 3 month, this is called as rule of Hasse. 4 month, 5 month. So it's like 1 ones are 1, 2 to square of 2 is 2 centimeter, then 3 threes are 9 centimeter, 4 4 the 16 centimeter, 5 5s are 25 centimeter. This is rule of Hasse. Then another rule was there, rule of Morrison, which is called as, sir, 6 month, 7 month, 8 month, 9 month. 6 months, 6 5s are 30, 7 5s are 35, 7, 8 5s are 40, 9 5s are 45, 10 5s are 50, 10 5s are 50, my dear friends. So this is height in centimeters. So if we say like this, 7 month onwards also, the baby is considered as viable. The crown to heel length should be at least 35 centimeter. Other than that, eyelid open eyelid, crown to heel length 35 centimeter. Then ossification centers like sternum and talus. Sternum and talus, we all know sternum and talus is developing at 7 months. 7 months of intrauterine life. 7 months of intrauterine life. Also crown to heel length is also seen at 7 months of intrauterine life. So 7 months is right here very important. 7 months is very important. Ossification center like talus and sternum, if they are there, that means they are developed at the 7 month of intrauterine life. Crown to heel length, if we talk about, that is 35 centimeter and eyes are open. Now the important terms which you need to understand right here, sir. Two important terms are here. What are the two important terms we are having, sir? One is intrauterine death and another is stillbirth. So these are the two definitions which should be very clear in your head, my dear friends. First, we have intrauterine death inside the uterus. Any death during the pregnancy. The period of pregnancy is 280 days. 280 days. 280 days is a period of gestation. If death is happening inside the uterus, my dear friends, we call that as intrauterine death. Stillbirth is baby death in the birth passage. What is birth passage? After uterus, if I draw like this is uterus. This is uterus. This is cervix, then vagina. Cervix, vagina. Cervix, vagina is there. This is uterus. Now, if the baby is dying here, this is called as intrauterine death. If, sir, the baby is dying in the birth passage, this too, cervix, vagina, this is birth passage. We call this as stillbirth. Means the baby was alive, but before coming out, he died in this passage. This is called as what, sir? Stillbirth. This is called as stillbirth. So two definitions are very much clear in everyone's head, my dear friends. Stillbirth. Now coming to some important terms right here, sir. Putrefaction, mummification, maceration, which is seen in the baby who is dead already. And most commonly it is seen in the intrauterine death, my dear friends. Stillbirth, it is not most commonly seen, but intrauterine death, if we have to take heading, intrauterine death. Intrauterine death. In intrauterine death, you will see the putrefaction. What is putrefaction? How it is happening? You know, putrefaction and mummification. Putrefaction, we know this is decomposition of the body by the inner enzymes. So what is happening? The membrane rupture and the air enters inside along with the bacteria, result in the putrefaction of the baby. That means the baby has died inside the uterus only. Baby died inside the uterus only, and remember, once the baby dies inside the uterus, the membrane, fetal membrane got ruptured. When fetal membrane got ruptured, my dear friends, the bacteria entered, and because of the bacteria there was putrefaction, and we all learned putrefaction is the surest sign of death. Putrefaction is the surest sign of death, my dear friends. Putrefaction. Now second thing is mummification. Mummification is intact membrane. Membrane is intact now. Because of the intact membrane, no air is going in. No air going in. That means it is drying and dehydration. Drying and dehydration, no blood supply is going, that will result to mummification, and mummification you all know is odorless. Third thing we need to understand and remember right here, sir. The third thing we need to understand and remember here is what, sir, here? Maceration. Is what, sir, here? Maceration. Maceration is intact membrane and lot of amniotic fluid inside which cause lysis of the baby. Membrane is intact, but the problem is amniotic fluid inside. Maceration is happening because of amniotic fluid inside which causes the lysis of the baby, which result in the maceration. These all are the signs you are going to see in the intrauterine death. If I show you the diagram, this is maceration. The maceration of the autolysis is happening of a baby's skin. You can see the peeling of the skin over here. The membrane was intact. The cause is amniotic fluid right here, sir. Then coming to the putrefaction. Putrefaction, what is happening in the putrefaction, sir? The membrane ruptured. Membrane ruptured. Bacteria entered. And because of that, lysis happened. Lysis happened of the baby. Now, sir, mummification. Membrane was intact. Membrane was intact right here. And because of intact membrane, what happened? No blood supply. No blood supply. No oxygen. No blood supply, no oxygen, guys. And because of that, there was dehydration, drying and dehydration if baby born like this. Then one more thing you need to learn right here is, sir, Spalding sign. What is Spalding sign? Overlapping cranial sutures. Cranial sutures are, this is one cranial suture, this is two, they are overlapping with each other. This is called as Spalding sign. This is called as what, sir? Spalding sign. So these are the important things you need to understand and learn right here, sir, with the help of the images. Now let's see the signs of maceration. Very important. Signs of maceration, where the cause is amniotic fluid. The skin slippage and valve formation. Skin is splitted like this. You can see here, sir. Next is abdominal bloating. You can see the abdomen is distended. If it's a normal abdomen, it will bloated like this. Hypermobile joints. The joints are hypermobile. You can easily take them back, put them front. Ammonical smell will be there in the maceration. The maceration, ammonical smell will be there, my dear friends. So there are the 4 signs of maceration. Skin slippage and valve formation, abdominal bloating would be there, hypermobile joints will be there, and ammonical smell would be there, my dear friends. Ammonical smell will be there. Now, radiological sign of maceration. How you check the maceration has happened radiologically. So guys, radiologically if we talk about, number 1 would be the Robert sign. What this Robert sign is, my dear friends, if we talk about the Robert sign, what is this Robert sign? So Robert sign is presence of gas shadow in the chamber of the heart and the aorta. If there is a gas shadow present on ultrasound, we can find the gas shadow in the chamber, and on USG, the gases etc. they look black. X-ray also gases look black, my dear, fluid looks grey. So there is a presence of shadow in the chamber of the heart and the aorta, and this is seen less than 12 hours. This is seen less than 12 hours. Second thing which we need to learn right here is Ball sign. Ball sign. Ball sign is due to hyperflexion. The baby is hyperflex. The fetus curves like a ball. Like a ball is there. The fetus also curves like this because of hyper. This is ball sign. Ball like fetus. If the fetus is like a ball, it will be turning like a ball. Then coming to the dual halo sign. After fetal death, the subcutaneous fat in the scalp separates from the skull wall. Subcutaneous fat in the scalp separated from the skull wall, and this is seen 3 days onwards. If the intrauterine death has happened 3 days, after that only it is going to be visible. The fourth sign we have to see right here, sir. The fourth sign is Spalding sign. The fourth sign is what, sir? Spalding sign. The cerebrum shrinks, my dear friends, and vault board override each other. Spalding sign. We have seen this. The cerebrum shrink. Cerebrum is in the anterior side, bellum is in the posterior side. The cerebrum, due to shrinkage of cerebrum, the overlapping of the cranial sutures, skull vault would be overlapping each other, my dear friend. This is called a Spalding sign. This is called a Spalding sign. So again, all the signs I want to repeat with all of you. Let me just erase it and want you to learn along with me, my dear friends. So first of all, there will be a Robert sign, presence of gas shadow in the chamber of heart and aorta when it is visible less than 12 hours. Then coming to the ball sign. What is ball sign? Due to hyperflexion, fetal curves like a ball. Then Duval's halo sign. After fetal death, the subcutaneous fat in the scalp separates from the skull wall. Seen 3 days onwards. Spalding sign. Cerebrum shrink and the skull vault, the sutures are now overlapping each other, making the head looking like compressed head, my dear friends. So these are the important signs of the maceration. Now coming to the next, grades of maceration. The next topic is what, sir? Grades of maceration. If we talk about the grades of maceration, stage 0, red skin would be seen. Grades of maceration, stage 0, red skin would be seen, my dear friends. And stage 1, there will be peeling of skin. Stage 2, peeling plus blistering, and stage 3 will eventually end up with mummification. That means after maceration, you can see mummification. Mummification is a stage 3 of the maceration. Again, along with me, stage 0 is red skin. Stage 1 is peeling of skin. Stage 2 is peeling plus blisters are there. Stage 3 is mummification. Stage 3 is mummification, my dear friend. Okay, done. Now, important test for live birth. How you'll come to know the birth was live or not? Now, my dear friends, objective in autopsy is to know if the baby respired or not. After death, what if in a hospital you are working, baby was already dead and you delivered the baby, baby was already dead, you need to prove the attendant that he or she was already dead. For that purposes, this forensic science is helping us. This is a defense for a doctor. What if baby respired after the death, after the birth and then died? Then there can be a responsibility of a doctor. So to differentiate all these things, whether respired, not respired, before only died, or death happened in the birth canal, or after coming outside the baby died, in all those scenarios, we have to perform different tests. So important tests for the live birth right now. If these tests are positive, that means that the child respirated, the child vitals were present after the birth. If not, that means child was already dead. Maybe the death happened in the birth canal only. You understand? Now we talk about this thing, level of diaphragm. If not respired, if after the death, the child did not respired, my dear friends. If child did not respired, then the level of ribs would be, that level of diaphragm would be at 3rd to 4th rib only. If the child respired even once after the birth, my dear friends, the rib would be at the diaphragm would be at 6th rib. The diaphragm would be at 6th rib, my dear friends. If this is sternum, these are the ribs. You will see 1, 2, 3, 4, 5, 6. If unrespired lung would be there, unrespired, then only between 3rd to 4th rib, unrespired. And if it is respired lung, you will see it at 6th rib, my dear friends. 6th rib, my dear friends. So this is a level of diaphragm we are checking right here, sir. Now coming to the next test called as Fodder's test. If we talk about the Fodder's test, guys, for the weight of the both lung. Forder's test is for what, sir? Forder's test is for weight of both the lung. If not respired, then the weight is 30 gram. If not respired, then the weight is 30 gram, and if respired, then the weight would be 60. Just the double. Weight doubles. Weight doubles. Weight doubles after respiration. Weight doubles after the respiration. 30 gram, then 60 gram it will become. Next is what, sir? Redden's test. Next test is Redden's test. Redden's test, middle ear is check. What to check? What to check? Middle ear is check. If not respired, gelatin is present. In the unrespired lung, my dear friends, unrespired baby, gelatin is present. If respired, if he took one breath also, this will, the air is present. Not respired, gelatin will present. If respired, air will be present there. Not respired, gelatin. Respired, air will be present, my dear friends. Now coming to the fourth one. Breslau's second life test. Breslau's second life test. Breslau's second life test. It is a stomach bowel test. Bowel test. It is stomach bowel test, mother. Stomach bowel test. Place the stomach in bowl of water now. You take a bowl of water. Bowl of water. Put stomach inside. Put stomach inside, my dear friends. If not respired, it will sink. It will sink. It will be here. If not respired. If not respired. If respired. If respired, my dear friends, then your stomach will float. You will see your stomach on the top. Stomach will float. So these are the Breslau's test. Now coming to the fifth test. Fifth test is hydrostatic test, or it is also called as Reigard's test. Hydrostatic test or the Reigard's test is there. It is the lung floating test now. If unrespired lung is there, this is lung floating test, my dear friend. If unrespired lung is there, the specific gravity of the lung would be 1.04. If respired lung is there, now the specific gravity is 0.940. So this is, and they float in the water. They float in the water. How to perform this test, my dear friends? Lung inside the water floats. Lungs inside the water floats normally. Sequence of the lungs to check the residual air. After squeezing, if the lung floats, that means the test is positive. After squeezing the lung, after squeezing the lung in the water, so how to perform this test? Normally, lungs inside the water floats. It will float normally. Okay? Normal lung means respired lung. So if we squeeze the lung and then put inside the water, if that lung floats, that means the test is positive. That means that baby respired before after the birth. Before dying, after the birth, the baby respired. Now false positive test. Baby not respired, but still lung piece floats in the water. Not long, it is lung. Baby not respired, but still the lung piece is floating in the water, my dear friends. Example is putrefaction. In putrefaction, you are going to see the false positive result. So this example you need to remember. False negative. Baby respired but lungs do not float. There can be the chances where baby respired but lungs are not at all floating, my dear friends. So what examples we can choose right here for this? If it is, example is pulmonary edema, atelectasis. What is atelectasis? Collapsed lung. Collapsed lung. collapsed lung is called as atelectasis. Lung infection, any kind of TB, pneumonia, then also it will not float, my dear friends. Other thing is important right here, sir. What is that? Just need to add one thing is there. That is called as Munchausen syndrome. Munchausen syndrome. Munchausen syndrome. Munchausen syndrome. So other thing is Munchausen syndrome. You can write it. Munchausen syndrome by proxy. Proxy can be parents, my dear friends. So what is happening? You will write down the important points along with me. Parents fabricates the problem in the child, but it is not. And that problem is not at all matching with the real scenario. They are saying something, happened something else, and there is nothing. No disease, still they are pretending their child is sick. This is called as Munchausen syndrome by the proxy. So what points we need to add right here, sir? First thing is parent fabricate illness in child to gain the attention. Second point you need to add, child may be brought to hospital multiple time with fake or unnecessary complaints. There will be a history of visiting multiple hospitals and doctors. So this is Munchausen syndrome by the proxy, where they are producing the fake symptoms just to gain the medical attention from the different hospitals, different doctors, but the actual scenario is something else, my dear friends. The next topic what is there in this chapter is Battered baby, a very famous topic, Battered baby syndrome. Battered baby syndrome. Sir, in Battered baby syndrome, you need to remember the salient features of Battered baby syndrome. Salient features. First of all, injury and history of injury given by the parents not matching. Other than that, delay in injury and the medical attention. Then multiple injuries with different age. One is fresh wound, another is old wound, the oldest wound 1 day, 2 day, 3 days. These kind of histories can relate it with something has happened to the baby by the parents or the guardians who are getting the baby to the hospital. That means baby assault has happened, and this type is called as Battered baby syndrome. Other features can be slap mark, pinch mark, So you see all the assault is going on. Then bruise will be there, 6 penny bruise, 6 penny bruise. Six penny bruise will be there. Cigarette burn marks would be there. So these things can be seen in a baby who was assaulted by the parents, and now they are getting that baby for the medical treatment. Other than that, there will be a shaken baby syndrome. Shaken baby syndrome. In this shaken baby syndrome, what they are doing, they are shaking the baby like this. Because of shaking of the baby, you will see there will be injury to the head plus injury to the ribs. From where they are shaking, they are using this axillary region for the shaking of the baby. So you are getting rib fracture here and also head injuries. So you will see there will be a eggshell fracture of skull plus it can also lead to hypoxic ischemic encephalopathy in the child also. Plus it can lead to the fracture of ribs near the axillary area, axillary surface. So this is all about the Battered Baby Syndrome we have learned, and with this we have completed this chapter. Thank you so much.